Welcome to this explainer. You know the drill. You feel a little off, and boom, the first thing we do is reach for a thermometer. But today, we're going to discover why that number flashing on the screen is so much more than just a random metric. It is a highly guarded, incredibly sophisticated biological set point. Today, we are fully decoding the body's ultimate smart thermostat. Here is our roadmap for today. We're going to cover vital sign status, the core physiology, clinical benchmarks, measurement sites, core versus surface temperatures, and we'll wrap up with some really essential temperature facts. All right, let's kick things off with Section 1, body temperature is a vital sign. So, before we really get into it, we have to ask, what is a vital sign anyway? Well, the absolutely crucial thing to remember is that it's an objective measure. It's not about whether you feel hot or cold. It is hard biological data coming straight from your vital organs to tell us exactly how your body is functioning right now. Since these signs are managed by your most critical organs, even a tiny shift away from the norm is a huge red flag. It's basically your body's built-in early warning system, sounding the alarm long before you even realize you're sick. And as you can see here, temperature sits right at the very top of our standard vital signs list, anchoring your overall physiological health. With a normal baseline of 98.6 degrees Fahrenheit, or 37 degrees Celsius, it lines up right alongside your pulse, respiratory rate, blood pressure, and standard pain levels. Those are the big 5 metrics of human health. Sure, we have others like blood glucose, but temperature, that is the classic, unwavering baseline we always come back to. Moving right along to Section 2, the core physiology of temperature regulation. Okay, so how on earth does our body stay locked at that magical 98.6 degrees? Well, the secret is all in a tiny, unbelievably powerful part of your brain called the hypothalamus. Think of it kind of like a super advanced smart home thermostat, but for your body. It doesn't just guess how warm you are. No, it's constantly pulling in real-time data from microscopic thermal receptors all over your skin and deep inside your core. It's literally working 24/7. To keep that perfect thermal balance, your internal smarts thermostat is managing a never-ending tug-of-war between two opposing forces. On one hand, we've got thermogenesis, that's heat production. Your body is firing up the furnace by burning the food you eat and through physical exercise. On the exact opposite side, there's thermolysis, which is all about getting rid of that heat into the environment around you. Perfect health basically means these two forces are playing in perfect harmony. Now, how are we actually losing that heat? If you're thinking sweating is the main way, well, prepare to be surprised. A massive 60% of your heat loss happens completely invisibly through radiation. You're just radiating it out into the room. Meanwhile, actually touching colder objects, which is called conduction, only accounts for a measly 3%. The remaining 37% comes from evaporation and convection. So yeah, you are quite literally a human radiator right now. But what happens when things go haywire and your environment overwhelms that delicate balance? Well, if you get too hot, the brain's alarms go off. It triggers vasodilation, which widens your blood vessels to dump heat out through your skin, and it ramps up the sweat glands to cool you via evaporation. On the flip side, if you're freezing, your brain triggers vasoconstriction to hoard warm blood deep inside, away from the skin. Then, it forces your skeletal muscles to just rapidly fire. That is exactly what shivering is, a violent, rapid muscle contraction designed purely to generate metabolic heat and save your core. Which brings us perfectly to Section 3, clinical benchmarks of body temperature. So, when your smart thermostat starts losing the battle, doctors use 7 specific clinical benchmarks to gauge just how serious things are getting. Right in the sweet spot, we have euthermia, or normothermia, at exactly 98.6 degrees Fahrenheit. Drop down to between 95 and 98, and you're in the subnormal zone. Below 95, that is dangerous hypothermia territory. Going up the scale, a fever is clinically called pyrexia. It starts as low pyrexia between 99 and 100 degrees, bumps up to moderate from 100 to 103, and hits high pyrexia at up to 105. Anything above 105 degrees is severe hyperpyrexia, which is incredibly dangerous because your body's internal environment is critically compromised at that point. All right, let's jump to Section 4, common sites for measuring temperature. Knowing those benchmarks is definitely important, but we also have to talk about where we actually collect this data. Usually, medical professionals treat the oral temperature, taken under the tongue, as the standard baseline. But here's the catch. Compared to the mouth, an axillary reading, which is taken under the armpit, is pretty consistently 1 degree Fahrenheit cooler. On the other hand, a rectal reading runs about 1 degree Fahrenheit hotter than your mouth. So you always have to factor in exactly where you're measuring when you're trying to figure out if you've crossed one of those clinical benchmarks. That leads right into section 5, core temperature versus surface temperature. This is a super critical distinction to make. Core temperature is the heat of your deep tissues and vital organs. It's heavily protected and insanely stable. We're talking fluctuations of less than a single degree Celsius over the entire day. Because of that incredible stability, the rectal measurement is basically the absolute gold standard for finding your true core temp. Surface temperature, though, that's the heat of your skin and external tissues, and it is bouncing around constantly based on stuff like the room you're in, what sweater you threw on, or the weather outside. Those oral and armpit measurements we just talked about, those are generally considered surface temperatures. Finally, let's wrap things up with section 6, essential temperature facts. To finish up this explainer, I've got 3 wild facts about your body's temperature that might completely change how you think about it. First up is your circadian rhythm, or diurnal variation. Your internal thermostat doesn't actually stay set at one single number all day long. It runs on a strict 24-hour schedule. You're actually at your coldest in the very early morning, between 4 and 6 a.m. when you're deeply asleep. Then it slowly climbs, hitting its maximum daily peak in the late afternoon, usually right around 4 to 6 p.m. So a mild fever right when you wake up might actually register as a much higher fever by the time dinner rolls around. Fact number 2. Our normal baseline actually cools down as we get older. We don't just keep the exact same internal temperature our whole lives. Newborn babies are naturally running pretty warm, maxing out at a normal baseline of 37.5 degrees Celsius. By the time we hit adulthood, that settles down to the classic 37 degrees. But as we move into old age, our metabolic rate slows. So we've seen how your body temperature is an incredibly objective messenger from your vital organs. It's fiercely guarded by your hypothalamus, it shifts with your age and the time of day, and it's all designed to keep your cells working perfectly. So the next time you feel a sudden shiver, or you break a sweat on a warm afternoon, don't just brush it off. Ask yourself, what is your internal smart thermostat trying to tell you today? Thanks for joining me on this explainer, and keep staying curious about the absolute marvel that is the human body.